For us laymen, when we hear plastic surgery, most often comes to mind is cosmetic surgery.
There's reconstructive surgery, where the main goal here is to restore function. And then on the other end of it, there's the aesthetic surgery, or what we commonly call cosmetic surgery. And this is the thing we struggle with as professionals, is that there are people who, as long as you have a pulse, they will do any operation you want. But a true professional will tell you this we can and this we cannot. The other critical bit is the conversation around what could potentially go wrong. Like I said, it's not marketing PR all the time. You're dealing with real people, with real surgeries, with real risks.
Asking for the ladies, not the men, is there a way to keep them up?
So plastic surgeons are not God. There are some things that, as much as we try and fight it, we can't completely negate it.
With ladies, in regards to the C-section scar, is it possible to get rid of one?
It's never possible to completely get rid of a scar. The conversation always has to revolve around the quality of the scar that is already there.
Interesting. Stretch marks. Are they in your scope of work?
They are notoriously difficult to deal with.
This BBL thing, sasa tunasaidiana aje bana?
A lot of people walking around with BBLs, you can't even tell that they had.
Ladies and gentlemen, classmates, CEOs, karibuni tena to another concert for businessmen. We like to keep it fresh here like that. How have you been finding the conversations? Kindly always engage with us. Comment, kuja kwa stories, kwa DM. Let's keep talking, see how we can make the show better, and tell us the guests that you'd want us to keep bringing to the show. We're still filming at Longonot Place. Come check them out. Book your staycation. On the site, tumeingia msimu wa sherehe nini, so they'll give you really, really good discounts and offers. Amazing space. I'm excited about today's conversation. Juleo manze tunatoka hapa tukiwa warembo. The gentleman sitting today and being our lecturer today is we're having a conversation about a topic that has been a bit touchy the last couple of weeks, especially in Kenya, not from a very good incident, but a lot of good has come from that world, and we want to delve into both sides. And today we are talking about cosmetic surgery with a gentleman who goes online with the name Rekebisha. Dr. Ogalo, how are you, sir?
I'm very well, thank you.
Unaturekebisha kabisa.
Leo, you and your crew, you live here looking like different people. Mentally.
Mentally. Bilgo after sasa hapa leo natoka na six pack nini. We'll get to that, man. Thank you so much for honoring our invite. Thank you so much for coming through.
Thank you for the invite.
Absolutely amazing. How does someone end up being a plastic surgeon? What does it take? How does that path look like?
Wow, where do I start? I mean, first of all, let me just say that I'm a big admirer of what you guys are doing here.
Thank you.
I'm a huge fan of storytelling in any shape or form that it does come in.
Awesome.
And this is just one fantastic way to get stories out there.
Awesome.
My story, it's a bit boring, if you ask me.
Let us be the judge of that.
I'll let you be the judge of that.
Yeah.
Actually, I usually have to think about this answer. I'll just start with a small story before I get into mine.
Yeah.
There's one time I was, in the very rare occasions that I was out in Nairobi, and I went into a club and I met a friend of mine. He's also turns out to be, he's a doctor.
Okay.
He's a very tall, large guy, very boisterous, loud, and, just full of energy and life. And I sat next to him and he was like, JP, how are you doing? And I told him, I'm good, tunangangana to, the way Kenyans say.
Yeah.
And he looked at me in the eye and he told me, that's the problem with you Kenyans. You never talk about yourselves. You never talk about your stories. You never talk about what you're doing and who you are. And this is where the Nigerians and the rest of the West beat us. You need to talk and say it with your chest.
But now umeanza na violence. Why are you attacking us? Wow. Love it.
So I'll try and do justice to the story as much as I can.
Awesome.
I am from a place called Kamagambo, which is in South Nyanza, Migori County.
All right.
But born and raised in Nairobi.
Okay.
So I went to... born in Nairobi, and then my father left the country for work. Okay. So eventually my sister, to the UK. So eventually my sister and I joined him there briefly for, I'd say, about 3-4 years. Came back to Nairobi when I was about 5 years old or thereabout, and went straight into primary school. So I skipped a bit of a step in nursery school. So if you notice I'm a bit slow or my English is not very good, it's because I didn't finish nursery school. So jumped straight into class 1.
Okay. You went to UK. Your English has to be better. But anyway.
I actually came back with a UK accent, and I'm a bit disappointed I lost it somewhere along the way. But anyway, so primary school, I was at Consolata school. So I did my whole primary education. Fared pretty well, I guess, in KCPE. And then from there, I went to Strathmore School, where honestly, it's where I built a huge part of the foundation of who I am today.
Okay.
And I honestly owe a lot to that particular school because apart from the academic side of things, where there's a focus on excellence, there is also a very huge focus on formation from a spiritual point of view. Right. Just they teach you how to become a man. And they kind of have their own, everyone has their own definition of what a man is. Some people want you to be hairy and punching everybody in the street. But this other brand was a bit different. So, yes, a huge focus on excellence, personal formation, introspection, understanding who you are, having principles in life, and ethics as well. It's important. Some might say it might slow you down along the way, but in the long run, it ages very well.
Yeah.
So I do owe quite a bit to Strathmore School.
Okay.
So after Strathmore School, again, I did pretty well. I was not in the newspaper or anything like that, but I then applied for medical school.
Right.
It was one of those things on my list. Okay. There, the decision to apply for medical school, I'm not quite sure where that came from, but I think I just feel it was something that was always, just kind of in me. There are only two things I've ever thought about becoming. One was a doctor, and the other one was a priest.
Okay.
And it's funny. I don't know if I don't know how it came about, but I remember at some point when I was already in med school, and my grandmother got quite sick.
Yeah.
So I went to visit her and went to see her, and by that time I was in med school, and we were talking. It was probably one of the last times we ever spoke, and she was telling me how she always looked at me and thought that I was going to become either a priest or a doctor, and we had never had that conversation before. So probably it was, in some way her prayers or her wishes that I took the path that I chose to take in terms of becoming a doctor, and not a priest. I mean, I didn't become a priest because, adolescence and everything that comes with it kind of, I chose a different path.
Okay.
So after high school, there was kind of like a bit of a break along my story because it took some time for the admissions to happen into medical school. And remember, I didn't go to nursery school, so I started everything a year younger than I was supposed to be. So I finished high school when I was about 17.
Right.
And I remember my mom felt that I know this guy is too young to go to university.
Okay.
So I committed the cardinal sin for anyone who's ever been to Strathmore, and I went to St. Mary's. Yes, arch rivals. I'm going to get a lot of heat for this, but it happened. It's a part of my story that I can't deny.
Yeah.
I didn't stay there too long.
Okay.
But St. Mary's was very interesting, and even during the brief period that I was there, it did shape some bits of my mind before, because you see, Strathmore was very academics oriented, science, spirituality, religion, all these kind of things. But when I got to St. Mary's, it was a completely different culture shift. I found people who were very expressive, very creative. That's true. They were very, the word is not laissez-faire, but they showed me something different that I really, really appreciated that school for. But I mean, on the academic side, it wasn't a very challenging experience for me. So during that period, I got now called to medical school.
Right.
So I joined medical school in 2005 and I finished in 2010. Somewhere along the way during medical school, my leaning towards plastic surgery began.
Okay.
During our fourth year of medical school, they usually have this thing called an elective period. So during an elective period, you kind of select any hospital, anywhere, it could be anywhere in the world, that you would like to go to and kind of intern for a period of time. I think the whole period was maybe 2 months or 1 month or something like this. So based on a recommendation from one of my senior colleagues, who's actually an ex-Strathmore guy, I went to a hospital in Johannesburg. It's called Chris Hani. Okay. At the time, I don't know if it still is, but it is the largest hospital in the world. All right. And it's smack in the middle of, Johannesburg.
In the world.
Yes. In terms of bed capacity and all these things.
Oh, wow.
Yes. So if you're training to be a surgeon, like that's the kind of place where you want to go.
Okay. Okay.
Yeah.
Yeah, sorry, no, it just caught me off guard. You don't hear that a lot. Like something is the biggest in the world.
Yeah.
And it's smack in Africa.
Yeah.
Oh, that's interesting. Well,
at the time it was.
churches.
Things might have changed. But at the time it was.
Right.
And it, like I said, it's smack in the middle of Johannesburg and they have an extremely ridiculously high crime rate. So there's a lot of stabbings, shootings,
Right.
car accidents, anything like that. So if you're somebody who is interested in trauma and surgery, that's the place where you kind of go to cut your teeth because quite a bit to learn. So, during that 1 month that I was there, I happened to kind of wander into the wrong operating theater, because I was looking for where my guys were, but I wandered into the wrong theater, and there was a patient who had this massive tumor on their back, and so they're quite a bit advanced in terms of the specialties that they have on board. So they have one team that comes to remove the tumor. And then I didn't know this. So they removed it and they finished removing it and they removed their gloves, started removing their gowns, and they left. The patient was still on the table, anesthetist. I was like, what's going on here? They're like, no, doc, don't worry. The plastic surgeons are coming in. I was like, the who? The plastic surgeons. So I was okay. So these two guys walk in, very cool, relaxed. They were wearing these things on their eyes. They're called loops. I didn't know that at the time.
Okay.
And they came in, and at the beginning of the operation, there was this huge wound on the back of the patient. And within an hour, it was completely closed up. And I found it the most amazing thing I had ever seen at that point in time.
Right.
So, they were doing the reconstructive bit of plastic surgery. And I was like, I just felt like, this aligns with me because I'm naturally somebody who is very inclined into solving problems.
Right.
I'm a problem solver. It's a gift and a curse because I also end up now picking other people's problems and trying to fix them, or people come to me with their problems.
Right.
And then, I sit down, but, it's just kind of my nature. Any problem you give me, I'll give you option A, B, C, D. And then do you want me to go to E and F? You can go to that as well. So, that in its sense, I think kind of also, piqued my interest and set me along that path of reconstruction, kurekebisha, in short. So then I came back to Nairobi. And then the second or third encounter I had with that inclination towards plastic surgery was just around the time of post-election violence.
Okay.
Because unfortunately, a lot of things happened in this country at the time. A lot of very gross things happened. People were maimed extensively during that period of time. There was a lot of burns, a lot of panga cuts, and all these kind of things. So I remember I was sitting it was a fifth year class, my final year. And the lecturer, who was one of the very few plastic surgeons at the time, came into the front of the lecture hall and he was on his phone. And he was on his phone for about 5-10 minutes. And I never used to sit in the front row. I was always somewhere at the back, just, doing our own things with my buddies. But this day, I ended up sitting in the front row. And once he hung up the phone, he was He had a not let me not say smile on his face, but he looked challenged, and he was saying how the phone call that he'd just gotten was from somebody who was injured during post-election violence and had their penis cut off, and they had called him in to now come and help and reconstruct. And again, I was like, okay, how far can this discipline stretch? Because that again was to me amazing. So by that time, they hadn't started training plastic surgeons in the country yet. So a couple of months later, I approached the same lecturer, and I was like, listen, that thing that you're doing, I want to do it.
Right.
Fortunately, I don't know if it's maybe just how my parents raised me or my experiences in high school and all that, but I've never been a person to struggle or dilly-dally around decisions.
Right.
I tend to be very decisive. So if I say, I'm doing this is what we're doing. And, and we're going to succeed.
Yeah.
Or not, but this is what we're doing.
This is what we're doing.
We go with it. So I didn't consider too many things. I just saw it. I felt like it sat very right with my spirit. And I was like, okay, this is what we're going to do it. This is what we're going to do. So the next step is, okay, what does it take to get this thing done?
Right.
Fortunately, they had just begun setting the foundations of teaching plastic and reconstructive surgery at the University of Nairobi. The course hadn't been approved or anything, but the foundations had been set.
Yeah.
So I told the lecturer, listen, can I have your number? Because I was about to finish med school and go into internship. And I needed a connection to know, okay, when is this course starting? And, what can I do to get into this thing? So anyway, I finished my med school. I go do my internship in Embu. At which point, again, like I said, I was very focused and I knew that I wanted to do plastic surgery.
Right.
So I began aligning a lot of the things in my life towards that goal, especially when I was doing internship. So internship, you rotate through surgery, you rotate through obstetrics, gynecology, you rotate through internal medicine and pediatrics.
Right.
So I took my surgery rotation, very seriously. I took the rest seriously as well because, but I took particular interest in it and, started like kind of doing research, just on my own. And I wanted to put myself in kind of the best possible position such that when the opportunity did come up and the University of Nairobi was offering the course or any other university was offering a course, they would see that I really want this thing and I'd set a foundation for it.
Right.
Again, I guess it's what I was always taught, growing up, is that there isn't any substitute for hard work.
Right.
And the things that you want, you have to go out and get them. And they never just land on your lap.
Absolutely.
But, putting in the time, putting in the effort, being consistent with it, when the opportunities do come, and then, you leave yourself open to them. Some people call it luck. Others say that, no, it wasn't luck. Maybe a small element of it was, but I put myself in that position. So, that's what I tried to do as much as possible. Then I came across the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons, which is the professional body that all plastic surgeons lie under in this country. At the time, there were probably about 6 or 7 active surgeons. And it's crazy how looking back, because I'm currently the vice president of that same society.
Wow.
So they used to have events on and off. So I would... I got the number of the secretary for the association, so I'd always call her, when's the next event? Make sure you let me know. So whenever there was an event, I would drive all the way down from Embu or, get in a matatu, come, sit in the event and go back. All right. So I'd sit among the plastic surgeons and, just interact with them. And slowly they're like, hey, who's this guy who's always coming for, our events and that kind of thing. So anyway, fast forward probably about a year or 2 after that, 2013 to be exact. I started my internship 2010. Is when they officially opened up the plastic and reconstructive training surgery program in Kenya and at the University of Nairobi.
Right.
Probably just a brief part I've missed in the story is after Embu, after I did my internship, I was posted to Marsabit.
Okay.
Yeah, which for me was a bit like, man, because it was, my goals were all in Nairobi because that's where the plastic surgeons were. That's where
Yes.
the training was. That's where all the events were happening. That was the epicenter of this thing that I wanted to do.
Right.
Yet, I'm being taken this other side
Yeah.
of the country. But it's nothing you can do about it. The government tells you to go, you go.
Yeah.
Right?
Sure.
So I went, I reported, and I never went back. I ended up.
Now they will know.
Yeah, now they will know.
Yeah.
I ended up visiting so many government offices, just trying to get my posting changed because there's no way I was going to be doing Marsabit, Nairobi.
Yeah.
I'm just too far away from everything.
Right.
All right. And I'd set my goal on this thing. And I was like, okay, this is not aligning with what I want to do. So eventually I managed to get posted back to Embu.
Okay.
And I remained there for another year. But again, I quickly got bored. I mean, I was in surgery for that 1 year, but
Yeah.
I had exhausted everything I could do with that level of skill and that level of training at the time. And I felt like I needed to move out of Embu. And there are two ways that you could do that. You could either wait for the government to sponsor you and take you into the program, which would have required that I work for the county for another 2-3 years.
Okay.
And I just felt like I had done enough.
All right.
So I quit government service. Just around the time that I had already been accepted into the program. All right. Being accepted in the program wasn't too difficult because they'd seen this guy hanging around us for the last 3 years.
Yeah.
And presenting at their conferences and all this kind of thing. So I got in at the first time of asking, and we were actually one of the first classes of plastic surgeons to be trained locally here in Kenya. So I got in the first time of asking, so I moved back to Nairobi and now had to get a job at one of the private hospitals.
Yeah.
And then now started my journey through postgraduate training, which was just quite hectic because I was working at night and then during the day I was training.
Yeah.
And, it was Kenyatta Hospital and, another hospital not too far away from it. So I just sleep this side, not sleep, work the whole night and then cross the road, come back this side and then wash, repeat. Which was, quite
Hectic.
It was very hectic.
Yeah.
It was very hectic to the point it began to get very detrimental, to me. In several ways. So, I mean, one was obviously my health.
Yeah, for sure.
One was my health. And I remember actually one time just collapsing from the fatigue of doing it all. And I had to kind of rearrange, a few things in my life and let go of certain things like, you can't go out Friday, Saturday. When you're in your 20s, you want to do all those things, but you can't go out Friday, Saturday. Alafu unaenda kucheza ball Sunday, and
for sure.
You're working at night, and next day is school. So I had to clean up a lot of things after one of those things, and then I had probably again in my own personal reflection one of the very defining moments of my career where I failed. I failed twice. My second year of postgraduate studies.
Yeah.
So, when you failed, you get a supplementary exam. So you kind of resit. So I failed. I didn't flat out fail the entire year, which was, it was good. So I failed once. A couple of months later, I came back, sat a supplementary exam, and I was like, this one, we have it. And I failed again.
Oof.
So I failed twice in a row, which set me back an entire year.
Oof.
And it was a new experience for me because, as I mentioned to you, academically, I never really struggled. I was always so used to, getting good grades and this like that. And I looked at that situation and I was like, how can this possibly be happening? And I could not make sense of it, facing failure like that. And, you begin to question yourself. Like, am I in the right place? Am I doing the right course? Maybe I shouldn't be doing this. This thing is too hard. Should I quit my job on this side so that I can just focus on my studies? All those thoughts, came through my mind. But I looked at it a bit different, and I started trying to see, because it became apparent to me that, look, medicine can't be the end all be all of who I am and and what I am. So what other things exist within medicine or outside it that I can latch onto, that I can do, and all these things. So that's at that point then I began a different path into entrepreneurship and research and all these kind of things, which really, really, really opened up my mind to these other things. And I just came back, applied myself, because I was sure, like I was, even after all that battling with my conscience, I was convicted that I'm in the right place.
Okay.
And it was like, JP, this is the bump in the road. Get over it. Get comfortable with failure, because it has happened. It's likely not going to be the last time that this is going to happen.
Absolutely.
And it allowed me to get very comfortable with failure and to embrace it. And that has again guided me along the way to the point where I get to now.
Okay.
So anyway, after re-strategizing a bit and reapplying myself, I eventually passed the exam. That was second year, and then third year, fourth year, fifth year, I didn't have any issues.
Right.
So I eventually graduated in 2019 with my master's degree from 2013. So 6 years.
6 years.
Yeah.
Yo, I see doctors on the street demonstrating and saying wanafaa akilipueni. Where 6 years plus before that you're done another 5 years.
Yeah.
Yo,
So
that's 11 years.
of school.
Yeah. Wow. And during these 6 years, you start practicing after the 6 years now in terms of plastic surgery. I know you were still working.
Yeah, so I was still working, but as I was working as pretty much just a medical officer, because I didn't have the postgraduate training. I had a lot of skills that I had built up over the time, because it's a training program and you train by apprenticeship.
Okay.
So I had a lot of skills
that
I used, but I was still essentially, a medical officer. And at the time, a lot of my seniors would allow me to operate with them, tag along with them. So I was doing a lot of plastic surgery work, even outside school.
Right.
Just because it's like anything else, it's repetition. It's doing things over and over and over and over again. That's how you build your muscle as as a surgeon. It's in the actual doing of it, and literally every opportunity you get to do it, especially when you're in training, is an opportunity that you should ideally take.
Okay.
So again, that also put me in a good place, because I did quite a lot in that 6 years.
6 years.
And
amazing.
Again, like I said, I knew where I was going. So within that 6 year, I'm also now kind of setting the foundation of a lot of the things that you see JP as today. In terms of the relationships, the kind of doors that has opened, the places I'm able to go, the places I'm able to operate,
Right.
And that kind of thing. So
there's something that has piqued my interest. I mean, I still want to continue the conversation on being a plastic surgeon, but you were very clear about what you wanted to do from a very early age. I mean, by the time you were joining campus, you were pretty clear, I want to be a plastic surgeon. And I've been to a couple of events, and I've had young people just ask me a question like, Phil, I'm in my early 20s. I still don't know what I want to do with my life. And I've always grappled with that question, because I'll always tell you, take your time. We all have different paths. Do you feel like there's a formula? Because I feel the fact that you already knew what you wanted to do from such an early age gets you 10 steps ahead of everyone else, because you're super focused, you're laser focused. So, you're moving, you're not wasting time on sideshows on the side. You're going for it. Yeah, for the young viewers watching, is there a formula, or this is just something for you and I to, because I knew from a very young age I wanted to be a filmmaker, so I've never been derailed with other careers. I just went for it.
No, I don't think there's a formula.
Yeah.
I think a lot of the things that we are in life, or the things that we are to become in life, are a combination of our experiences, who we are as a person, and fate at the end of the day.
Right.
I guess the only thing that maybe was different from me was I had like I said, because of my high school experiences, I had a fairly good understanding of who I was
Right.
at the time.
Okay.
And I didn't grapple with that. So, understanding the decision maker makes the decision a lot easier.
Oh, yeah.
All right.
Absolutely.
Sometimes we focus too much on what the decision should be. Should it be architecture, engineering, and all these things, as opposed to focusing on the person who is making the decision? Who is that person and what do they want? I know it sounds like I'm speaking parables, but
I get you.
I don't know any other way to articulate it.
Yeah.
So, I would say anybody who's, kind of going down that journey and, battling with it, take some time with yourself to understand exactly who you are. And that will make the decision of where you're going, a little bit easier.
Absolutely.
And be open-minded. Be open-minded. Be able to see where there's an opportunity, and trust your gut, trust your instincts. And then again, there's obviously the thing for I'm a genuine believer in nothing good comes without hard work and the consistency.
Yeah.
Okay.
Yeah.
Because sometimes we're too early to dismiss a certain path because it's difficult, because I don't feel like I'm in the right place.
Right.
And as much as I respect that feeling of not being in the right place, is that feeling blocking you from what you're actually supposed to become? I can't answer that for anyone, but there's no path that you're going to take that's going to be easy.
Right.
Right? It all requires the hard work and the consistency. In fact, for me these days, if things are too easy, I'm like,
what's wrong here? What's not going on?
What am I missing? It's too good to be true.
For us laymen, when we hear plastic surgery, what most often comes to mind is cosmetic surgery. I think we've kind of blurred the lines, and I'm listening you talk and I'm like, wait, the surgeries you actually perform and you work on are life-changing, sometimes life-threatening surgeries. But it's not, for us, we think cosmetic surgery, we think liposuctions and, all these procedures. Can you differentiate? Is there a difference? Plastic surgery, cosmetic surgery? Is there even a difference?
Okay. Yeah. So, so I'm a board certified plastic reconstructive and aesthetic surgeon. All
Okay.
right? The degree you get after those 110 million years of school
100, yeah. I get you.
is a master's degree in plastic reconstructive and aesthetic surgery.
Okay.
So
three
it
in
essentially has two dimensions to it.
Okay.
There's reconstructive surgery, where the main goal here is to restore function. Okay. So you're talking about patients with burns, cut wounds, hand injuries, tumors, because we remove tumors, skin tumors and that kind of thing, and then reconstruct them. So that's the reconstructive surgery side of even things like cleft lip and cleft palate, some of those congenital deformities, issues with the ear, the nose. They fall within the domain of reconstructive surgery. And then on the other end of it, there's the aesthetic surgery, or what we commonly call cosmetic surgery.
Right.
So that's what people, immediately go to when they think about plastic surgery.
Yeah.
But it's also the way it's been, kind of
Hyped.
marketed out there. And, it's been our experience watching TV and listening to radio and all these things.
Right.
That plastic surgery just involves making yourself look better. So then there's the other side, there's cosmetic surgery or aesthetic surgery,
Right.
where we do the breast lifts, the liposuction, the tummy tucks, the facial treatments. We're talking about Botox, fillers, all these kind of things to improve our form, make us look better.
All right.
So any plastic surgeon you come across is ideally trained in both aspects of it. But plastic surgery has evolved quite a bit in Kenya.
Right.
So in the 80s, the 90s, and let me say probably the early 2000s, majority of the work was reconstructive surgery because that's what Kenya required at that point in time.
Right.
Okay. There was not much in terms of cosmetic surgery happening. But especially with the advent of the training program here in Nairobi, and just people's socioeconomics changing, there now became a demand for cosmetic surgery. So you have a situation where you're training more plastic surgeons and putting them into the market, and once you put them into the market, you kind of create a demand.
Yeah.
So even the people who previously would fly to Turkey or to Brazil to get their surgeries done can now have it done locally.
Yeah.
And, that has a knock-on effect because they tell a friend.
Absolutely.
And then, you have, people educating on social media that, plastic surgery is now here, you can get it done, all these kind of things.
There's a line that I see in your world which amazes me. It really interests me. And that is the balance between art and science. Because, it's taken you 11 years to master the science. But when you're doing reconstructive or aesthetic surgery, there's an art to it because you're enhancing someone's look, for example. And, I had that experience. I don't know, it's a weird conversation, but anyway, here it is. We did a film in 2021 called A Grand Little Lie. And some of the scenes we were shooting in an actual mortuary. So we got to spend time with mortuary attendants and the guys who clean up and, prepare the bodies before a funeral. And the most interesting thing is how this gentleman was so good at makeup. For me, it was, wait, no, we're in a mortuary. Why are we talking about makeup?
Yeah.
And just watching him have a conversation with our makeup artist there.
Yeah.
And he's going into detail about tones. And for him, it's how passionate he was about giving this person their last rite and the last send-off and letting the family have the best memories of this person.
Yeah.
So he's a really good barber because he will shave the body's hair. He will do the makeup, touch-up so that you look as much as you looked when you were alive. And from that day, I started viewing things, there's an art, there's a science.
Yeah.
How do you balance it?
It's a very good question. And I was actually discussing it with one of my colleagues last week about what it means to have an aesthetic eye in our discipline.
Yes.
Because not everybody has it.
Thank you.
And if you don't have it, it's something that's very difficult to train. You kind of either see it or you don't.
Right.
All right. So there's the anatomy. There's the anatomy and then there's the physiology, which are fixed. Those are well-documented things. Those are things that you can rely on to consistently remain the same to some degree all the time. But the aesthetics bit of it, being able to look at something and decide that it should look this way. Let's move it 1 centimeter this side or this side.
Yeah.
And it comes is one with experience.
Right.
But understanding that anatomy is very important. All right. So like looking at your face, I can understand why this side looks like this side, what muscle is doing this to this. Yeah, I can look at your skin and tell you kind of what's going on with your skin. It's not something that you can train, in my opinion. You either have that eye or you don't have it.
Right.
Yeah, but there's a marriage between the two things.
Wow. Okay, interesting. Allow me to focus more on the aesthetic surgery. Reason being, I think it's a very trendy conversation all over the world. And it's unfortunate, but in the last couple of weeks in Kenya, we had a case where a lady lost her life due to a botched surgery. I know it's a case that is an ongoing investigation, so you can't really go into details, but it really sparked a lot of conversations in this country. And then after that, I started paying attention. I'm like, oh my goodness. Oh, wow. Now there's so many, do I call them clinics that are coming up that are offering all these aesthetic procedures. And then, I travel kidogo and I realize, oh, wow, this is where Kenya is headed, because in the developed countries, I think every mall, every shopping complex has an aesthetic clinic. Like it's something someone will, during lunch hour, will go get some Botox or something done and then come back to work. I'm like, oh, wow. But it also looks dangerous. And I don't even know where I'm going with this conversation or the question, but for you sitting there as a professional, I'd want you to speak into it. And when should I seek out for aesthetic procedures? Or when should I stick to diet and working out? Where is that line? because I want to be beautiful, man. Me, I want to be handsome, and mambo ya gym ni ngumu. We, nimekuwa nikienda gym sijui miaka ngapi, sijaipata six pack. Mmecheka sana boss. Nini mnacheka sana? Yeah.
Look, where that line lies, honestly, it just depends on the person.
Okay.
All right. I am here as a vessel to facilitate that process for you professionally,
Right.
with a good outcome. I always tell my patients this, and it's good for people to know that anytime you're undergoing surgery, there's always a risk involved.
Yeah.
It's like anything else. It was unfortunate what happened, but it can happen. All right. That's the truth and the reality of it. It doesn't happen often. It actually is very rare that it actually does happen. There are people who undergo plastic surgery every single day. All right. You'll find even on a day like today, if I was, to round up all my colleagues and we just do a tally of all the procedures we did, you'd probably find it in the region of maybe 20, 25 people, every day undergoing some form of plastic surgery procedure or not.
Right.
All right. Unfortunately, the ones that make it to the press are always those ones that are kind of shed in a negative,
Yeah.
in a negative light.
Right.
Now, as doctors, one of the things that as professionals, it's important to use the word professionals.
Yeah.
Because some of the places that you've mentioned, popping up are not necessarily run by professionals.
Yeah.
So as professionals, we have a duty of care. A duty of care requires certain things from me as an individual, as the professional, that are my responsibility. One of those things is to make sure that I've attained the correct level of training to be able to provide you the service that you want. Okay? And that's evidenced in my degree, in my training. All right? And the second thing is for me to take that degree or certificate and take it to the medical council and show them that, look, this is me, I've done my training. And the medical council says, yes, you have. Go out and treat patients.
Right.
All right. So you get a certification or a board certification. The medical board recognizes you. And within every practice, there's what we call a scope of practice. Surgery has different disciplines. You have a plastic surgeon, you have a neurosurgeon, you have cardiothoracic surgeons, you have general surgeons. Now, we have different things within our scopes of practices. For example, I cannot go and do a neurosurgery procedure.
Yeah.
All right. I might know how to do it, but should I be doing it?
No.
No. It's better in the hands of somebody else.
Okay.
So that in the event that there is a complication or one of these risks are actually realized, then it's everything possible has been done, or they were in the right hands. This was just a matter of, a 1% risk of something actually bad happening. So on top of that is that when you do get a patient who is seeking that service, or who wants it done, and they come to your office, they need to be seen by the plastic surgeon or whoever is going to do this procedure on them. It's paramount, okay? Because what I find in my experience is that patients come in with a preconceived idea of what it is that they want, but what it is that they want may not necessarily be what it is that they need.
Okay.
All right. So that happens quite a bit. Okay. So you need somebody to guide them, because plastic surgery is not like walking into a supermarket and picking something off the shelf based on the brand. Okay. Because your neighbor has this one at Miwacha.
So I can pick like this pair of 6-pack.
No.
Okay. All right. I thought I could, add muscles to me. Okay. So it doesn't
you might want it. Is it possible?
Oh.
And to what degree is it possible?
All right.
Because, unfortunately, and this is the thing we struggle with as professionals, is that there are people who, as long as you have a pulse, they will do any operation you want, on you without guiding you and telling you like, okay, this will not work. This is the limitations of this. But a true professional will tell you this we can and this we cannot do. Okay. And sometimes even for you, I don't think we are a good fit. I'm not the right plastic surgeon for you. I cannot meet the expectations that,
you have.
you said, they're not realistic.
Okay.
Okay. So you come in for the consultation, and this is what I always emphasize is one of the most crucial bits of the relationship between a plastic surgeon and their patient is that consultation. All right. And, I ideally take anywhere between 1 and 1.5 hours for cosmetic consultation, just to work through things. So you tell me what your problem is and your problem areas are. Then we decide whether the expectation that you want or what outcome that you want, is it one that is realistic, and is it one that I can deliver to you? If I cannot deliver it to you, I'll tell you, this I can do, this we cannot do. Okay? We guide you through that whole process and, kind of synthesize every thought that you have in your mind in terms of what it is that you want to look like and how we can get you there in the safest possible way. All right? And then just the most critical, sorry.
Go for it.
The other critical bit is the conversation around what could potentially go wrong. Okay. Because like I said, everything has an inherent risk, including surgery. There's a chance you can get an infection. There's a chance your wound can open up. And that is a conversation that has to be very honestly had, with the patient. That said, a lot of these complications, there's a very low percentage of them happening. Most plastic surgeries go ahead without, any big issues. But having the conversation is the important bit. Informing the patient. It's called informed consent. The patient needs to know what the potential risks are. They also need to know what the alternative treatments are that exist. And they also need to be given the option of no treatment whatsoever. Okay. And that consultation is, again, a key thing because you build a relationship with the patient. Because like I said, it's not just picking something off the shelf. All right. If you're asking me to operate on you and increase your muscles times 2, okay. But you're more than just the muscles. You're filled. You have a pulse. You may have people waiting for you at home. Okay? And those are things that also need to be taken in by whoever it is who is treating you. We're not robots as surgeons and as professionals. There's a human element to this thing. And, that has to be captured. Like I said, it's not marketing PR all the time. You're dealing with real people, with real surgeries, with real risks.
Right.
Yes. So let's talk. Let's create a relationship. And then once we've done that, let's look for this fantastic outcome. And we all come out of this thing smiling, happy, with a good outcome.
Just let me know some of the most common procedures that you're finding have a lot of demand. I mean, the names we hear will be liposuction, Botox, gani zingine tunasikianga. Yeah. Which are some of the most common ones? What's the difference? Yeah.
Okay. So the typical patient would normally be a female, anywhere between the ages of 35, 55, sometimes 60. Sometimes you may get them slightly younger.
Okay.
For several reasons. One is obviously the economics of doing plastic surgery is not something that can be very accessible to guys in university or high school. And then also the effects of aging and life and, pregnancy and, food and all these kind of things. That tends to be the typical patient. Majority would, I'd have to say, be tummy tucks.
Okay.
Tummy tucks, liposuction, breast lifts as well.
What's the difference? Tummy tucks, liposuction.
All right. So liposuction is basically sucking out fat from underneath the skin.
Okay.
All right. We have fat all over our body. What insulates us, keeps us warm. But in some places of the body, that fat is unsightly, or we don't want it, or it's a nuisance.
Yeah.
Like underneath the arms, around the belly area, on the back. It doesn't make us look good.
If you're talking to me, talk to me directly. But yeah.
Yeah. So liposuction just involves sucking that fat. So you use a liposuction machine, put a cannula underneath the skin, and suck the fat out and contour the body. By contour the body, I mean we make it look nice, proportional, based on that aesthetic eye that I was telling you about.
And the saggy skin, because now you've just taken out the fat. So what happens to the skin? I know it was stretched out.
Yeah.
It's part of the...
So it depends. Different patients have different amounts of fat underneath the skin. So those who have a lot of fat underneath the skin, by the time you take out a lot of that fat, then you have saggy skin. Okay. So they're probably not the best candidates for liposuction. However, there are patients who they have fat, but they don't have too much fat. So you suck it out and the skin has almost its own innate ability to tighten a little bit afterwards.
All right.
The tummy tuck is a bit more of a level up because you remove that excess skin and fat. You actually literally cut it out.
Okay.
Yeah, and you can combine that with liposuction, for better results, better outcomes, lower downtime. And the breast lift is just as
Yeah.
it suggests, because again, with time and ligaments weakening and breastfeeding and just life beats down the breasts quite a bit.
Right.
So they end up sagging, and you want them back up where they used to be when you're in your 20s. And again, that's possible.
Asking for the ladies, not the men, is there a way to keep them up? Let's assume you don't get kids.
Yeah.
This is a conversation that comes up so often. You'd be
Yeah.
surprised. Yeah.
So plastic surgeons are not God. There are some things that, as much as we try and fight it,
Yeah.
we can't completely negate it.
Gravity has to do its thing.
Gravity will do its thing.
Okay.
Age will do its thing.
Right.
Now, that said,
Yeah.
okay, I can lift your breasts, all right, to a really, really good place. But it's unlikely that they're going to be in that exact place 10 years from now. All right. And let me clarify that, because people will start saying that, oh, no, this thing is completely useless. There's no point in doing it. It would be a lot worse if we didn't do the breast lift, is what I'm saying.
Okay.
So if you take two patients, okay, one who had already had saggy breasts and didn't get a breast lift, is probably 40 years old and is now, 60, 65, 70.
Right.
And one who had the same saggy breasts, but did a breast lift at the age of 40 and is now that same 65, 70.
Right.
This one will have much more saggier breasts that are a lot aesthetically pleasing. All right. This other patient will still have breasts that are high.
Right.
And have volume in them.
Right.
All right. They may not be exactly where they were immediately after they did the breast lift, but you'll have things that you're still proud of looking at in the mirror.
Yeah. In my wildest dream of doing this podcast, I never thought we'd have a podcast where we're discussing breasts, but here it is, man. I love this world. The surprises, just the punches come rolling in. Wow. One of my dreams, my goals, mi nataka kuwa mras. Man, is it possible to bring my hairline up to like close to my eyebrows? And can my hair grow? Nataka kuwa na dready.
Nataka na dready.
It's a lifelong dream. Yeah.
I mean, bringing it up to your eyebrow, I wouldn't advise that. In fact, I'll tell you no, because you're going to look strange. And then you're walking around with hair, and then you'll say you got it from Dr. JP. And then you'll scare away patients.
Watu tu wataongea. Well, anyway, okay. No.
But hair restoration is quite popular.
Oh, wow. Okay.
It's quite popular, especially in men, also in women as well, because our hair thins and falls off,
right,
because of hormonal changes for the most part. So genetics have a huge part to play in that. So if we catch it early, we start hair restoration treatments. The injections we can give you, there are creams, there are vitamin supplements that you can use to kind of bulk up hair that's already there. And if it's too far gone, hair transplant. If you want to bring your hairline forward, we can transplant some hair to the forward bit,
right,
and restore it pretty well.
Okay.
Very good results. Yeah.
Itabidi nikutembelee. My dream has to come true, man. My dreams are valid. I'm trying. I know we've talked about breast lift. I think another question I've seen that is really common is with ladies in regards to the C-section scar.
Yeah.
Yeah. I've seen a lot of mothers, and that's that's a scar there. And is it possible to get rid of one?
So here's the thing.
Yeah.
It's never possible to completely get rid of a scar.
Okay.
Yeah. The conversation always has to revolve around the quality of the scar that is already there. So anytime you cut any part of the skin or the flesh,
right,
you are going to get a scar. All right. It's only God who can undo a scar completely, 100%.
Right.
Okay.
Yeah.
Like I said, it's about the quality. So you can get scars that are barely visible from the time the cesarean section is done. I know my friend Christina was on this show a couple of months back. And she's very good at giving, really nice, CS scars.
Right.
But if you do have one that's bad, there are several ways we can approach it. There are surgical and non-surgical ways. Okay. You can simply just do a scar revision where we cut out the old one that wasn't too aesthetically pleasing and give you a new, nice, neat one. Or you can do less invasive things that don't involve surgery. So it's what we call scar management therapies that involve things like microneedling, PRP. There's lots of stuff out there, or even just steroid injections to improve the quality of your cesarean scar. And then there's another level to it as well, because if you have an ugly scar, but then you also have a lot of excess skin and fat in the lower abdomen, why not just do a tummy tuck as we're getting rid of the scar? So we get rid of the tummy and we get rid of the scar. I'll give you another scar, but you also get a tummy tuck as well.
Okay.
Yeah.
Interesting. Stretch marks. Are they in your scope of work? That's another big convo.
Yeah, stretch marks. They are notoriously difficult to deal with. They're very difficult to deal with stretch marks. You can get marginal improvements with some forms of treatment, laser therapies, microneedling. But with some of these things, you really have to manage the expectations, all right, from the get-go. And sit down with your patient and tell you, okay, the stretch marks, I can get you to here, but I can't get you to baby skin.
Right.
Yeah.
I feel like your world intersects a lot with the mental awareness, mental strength, or how people see themselves, because they approach you from an aesthetic point of view. But I'm sure you've sat across patients and you're like, yeah, it's not even your body. Because I've seen that a lot, in documentaries where someone will go for even 20 plus, 30 plus procedures, and it's more mental than it is physical. So every time they keep looking at themselves, they think they're not beautiful enough. And so they run to do some procedure. But the truth is it's up here. It's in the mind. How have you encountered that, and what conversation did you have with the patient?
Yeah, it does come up a bit, and I'm quite tuned into the mental aspect of plastic surgery because my wife is a psychiatrist. So we have very long, engaging conversations about mental health and how our different specialties intersect. So right off the bat,
and I'm sorry to cut you short. I bring that up because the debate, the unfortunate tragic event that happened with the lady, and the one comment that was consistent, it was right there, was, this lady is so beautiful. She did not need this procedure. I saw it so many times. I was like, okay, I will have to ask this question. Please continue. Sorry. Yeah.
Okay, now you're taking me down another rabbit hole. We could spend hours on this. So my take is usually a bit different. Okay, so just to answer your question, off the bat, so that patient who's coming in all the time, we do assessments, okay, for what we call body dysmorphia, because there are patients who have psychiatric illnesses that mean that it doesn't matter what you do to them or for them, they will never be satisfied, and they'll keep coming back in and coming back in. Now, if you sit down with a true professional,
right,
a real plastic surgeon, and these are things that we're trained to pick out. And usually two things would happen. So one is we would send you to a psychiatrist or a psychologist for evaluation.
Okay, that's important.
All right, and you come back, with a report. And, if the psychiatrist feels that you're okay to undergo the procedure, then, we proceed. Again, still at my discretion.
Right.
If I feel that, this is a no-go zone, listen, I'm not the right plastic surgeon for you. Or off the bat, if a patient walks into your office and they've already had 15 procedures and they want a bit more, then I'm not operating on that patient.
Yeah.
Because they'll never be happy, and it can end up being very detrimental to you,
right,
and your career. Okay. Again, professionals. Remember, professionals always have something to lose.
That is true.
Okay. So they'll do everything to make sure that whatever outcome they're giving you is one that is practical, safe, and an expectation that they can realize. Now, the average patient, because usually this question comes to me in the form of whether plastic surgeries are taboo or not.
Right.
And I always put it this way. We, as human beings, probably everyone in this room, spends a good chunk of their time trying to be better than they were yesterday.
That's true.
Whether it is doing an extra course, whether it is going to the gym, whether it is, buying a new coat or a new shirt, you want to look better than you were yesterday.
Yeah.
Because there's a satisfaction that comes from it. And there's also this word I like to use called quality of life.
Right.
You want to wake up every single day and look in the mirror and say, yes,
Yeah.
I like what's looking back at me. I'm happy. You go out into the world and your confidence is through the roof. And confidence is through the roof, you're able to excel. You're able to excel at work. You're able to excel in your relationships. You're able to excel at very many things. We all do that to some degree. Okay? Now, the question about whether you need to change your body in order for you to experience that confidence or for it to improve your quality of life, at the end of the day, it just boils down to the risk at the end of it. Okay? Because people would tend to say that this is not the right thing to do because the risk of doing it could potentially be death.
Right.
Correct? If that wasn't there, if you remove that aspect completely, then the conversation is a bit different. It would be like getting makeup. It would be like putting lipstick on your lips so that you look better. Okay? Because the risk of, something detrimental or life-changing happening to you is a lot lower. So it depends on what lens you look at it through. Okay. Now, if the conversation now then is about death and detrimental risk from the procedure being done, is where the professionals come in, okay? Because I'm telling you, I can deliver you this result with this level of risk involved.
Right.
Okay? And, that's just, the way I see it. There are a lot of things that are taboo, per se, but there are systems that exist for them to get done.
Right.
For example, somebody would say, divorce, that's a taboo, why would you do it?
Yeah.
But we do have structures that allow for it, okay? Even something like drinking alcohol, if you talk to certain people based on your cultural background or religious background, they say, no, that's the wrong thing to do. But there are systems and structures that exist for people to safely drink alcohol and enjoy a certain degree of quality of life, okay? So all I'm saying is, the people who want to change something about themselves, there's a reason why they want to do that.
Right.
Okay? They don't just wake up and do it for fun. A lot of the patients I interact with will give you very, very, gut-wrenching stories and very, very deeply felt stories about why they want to do this thing and what it will do for them. All right? I have patients cry in my office when they come 3 weeks down the line after their procedure and, telling you that you've changed my life.
Wow.
All right? You've changed my life. And the thing is, they're not going to tell you. They'll be walking around here in Nairobi and, you're just seeing a person who's undergone a complete makeover, looks different, is dressing different, is now walking around with their chest puffed out and they're happy. Quality of life.
I mean, just on that point, and the one thing I've been thinking about this, having these procedures so readily available to everyone is are you guys helping, with social media and everything? Are you guys pushing this narrative of, what word do I use? Beauty standards that are, just mostly unattainable? Because, I'm thinking there's someone in the gym every day watching their diet, doing everything there is, and the friend just walks into Dr. Ogalo's table and she comes out with a whole new body. Now, what are you telling this guy who's out in the gym every day? Shall I take the shorter route? Are you giving us unfair beauty standards, culturally? And then also, I'm curious, because you've had, let's say, men who've come in and they've said, I want my hair, I want my hairline extended, I want more hair on my head. Are you receiving a lot of cultural backlash because of some standards that you're giving us out here?
No cultural backlash.
Not yet.
To be very honest
Yeah,
with you,
that's awesome.
a lot of the people who would walk into our offices
Yeah.
again are very decided on what they want, and
Right,
they've battled with all these decisions and all that kind of thing. We are not creating unreasonable or unfair beauty standards. Okay, when I look at all my colleagues, even the ones who are on social media, I don't see any of them doing that. All right, because you see, if I was to promise you an unattainable beauty standard and I can't deliver it myself, then again, it's detrimental to me as a professional. All right. I'd rather give you something that's attainable.
Right.
The problem with our profession, the problem with sometimes the aesthetic industry is that it's infiltrated by people who have very, very huge financial interests. And those financial interests then blur the lines between ethics. So you'll find that crop would advertise things that are not attainable or are false advertising, and which is something that we are really, really trying to battle as professionals.
Right.
Yeah, it's tough. It's tough, but I just urge guys, go to a professional. See a plastic surgeon.
Where would I find you? What's the name of your practice? How would I get in touch with you?
So you can find me on my Instagram
Okay.
or on TikTok. On Instagram, I'm Rekebisha, at Rekebisha. On all the other social platforms, Dr. JP Ogalo.
Okay.
The list of places where you can find me are there, including the Nairobi Sculpt Aesthetic Center in Upper Hill,
Right.
where we do plastic surgery and we do it the right way. Our tagline is where art meets beauty.
Where art meets beauty. I love it. We're seeing a lot of medics coming up, and they're like very visible on social media, which has not been the case for a very long time. Your profession has always been treated as, that profession, let my work sell me.
Yeah.
But we're seeing more of you coming up and being more vocal online. And then now there's this intersection between marketing your work and your business and working with influencers, especially in your world, aesthetic. Do you work with influencers? What's your thought on that? Because again, a lot of the backlash I saw is we have all these influencers telling us what they're doing to their bodies, and now every person wants to go out there and have these procedures. Yeah. Your thoughts on influencers, social media? Yeah.
So the social media is the double-edged sword. Medicine is one of the oldest professions out there. It's it's very well guarded, and your ethics have to be to a certain degree when you're going out in the field of medicine. So it hasn't traditionally been a place where you would find doctors. However, where we are in a situation where it's the age of information, and information has to be free-flowing. Okay? So, traditionally, I could publish research in a journal, but it's never going to reach the people who actually need that information, which is the patient.
Okay.
You understand? Big journals that nobody can read and nobody can understand. So the approach now is, how do I effectively communicate to the person who is coming in for a treatment or who is considering a treatment, to make sure that they are armed with the correct information to be able to make an informed decision.
Right.
So the approach is mainly that of educational. All right. If you look at a lot of the content that I put out, it's educational.
Yeah.
It's not, hi, I am here.
Get ready with me.
Yes. It's okay. Liposuction. This is how we do it.
Okay.
This is what happens. This is what you should look out for. A, B, C, D.
Right.
All right. So that somebody can see that, okay, this is, something that, I think I can do. It is not so much advertising, which again can blur the lines, because advertising in its essence, what you're trying to do is to say, I'm better than the competition. Come to me.
Come to me. Yeah.
Right. Which is still not lines that we've crossed within our profession. The other reason why for medics being on social media is super important is, like I told you, the industry is being infiltrated by all sorts of people who have very huge financial interest, who have zero ethics or very little ethics, and they just want to sell a product.
Right.
All right. So how do you combat that? You have to come to the same playground as them.
That is true.
and try and play there and, battle for that, battle for that spot because, you are the light.
Right.
And, people need to see that. But people are not going to see it if you're just, in your office and publishing research.
Right.
And not that I have anything against research, but
Okay.
yeah.
Interesting. Do you have a memory of your most rewarding procedure? The one that just every time you think about your work, you remember that particular procedure and you're like, yeah, I have a reason to get up every morning.
Wow. Probably in recent memory, there was a lady I treated earlier this year.
Okay.
She had wanted to get a rhinoplasty done. So rhinoplasty is a nose job. She didn't like how her nose looked. And, she came, sat, we chatted, and, she'd been preparing herself for this thing for the longest time. So, I thought it was just, a regular consultation, a regular patient, so we went through the paces and we did the procedure. We did the procedure successfully. And as she was, recovering that night, so when I went to see her, after the procedure, she looked in the mirror. I think we handed her phone that she can look at her nose. And she immediately started crying. And she didn't stop crying until she left that place. And all she kept saying was, "You don't know how much you've changed my life. You don't know how much you've changed my life." I was here sitting as, it's just, regular rhinoplasty. And she couldn't go into the details of how or why I changed, changed her life. But her response, her emotion was so visceral. It was something that, it was so emotive that you could understand that, okay, this was a lot bigger than, the cuts and the stitches that are put on her face. Like, this lady has a completely different lease on life after this procedure. And she was extremely happy. Came back again 3 weeks after the procedure for like the final review, and again just broke down crying, saying the exact same words: "You don't know how much you've changed my life. You don't know how much you've changed my life."
So there was nothing biologically wrong with her nose. It was just she wanted it changed.
Yeah.
I think that's why I'm finding it hard for you, because someone comes to you, they really do not have a problem.
Yeah.
They just want a part of their body changed.
That's a problem. They have a problem.
That's a problem. Okay. I mean, anyway, that's a long conversation, and I know we can't finish. But who's telling people how a nose should look, and this is better than this, and that's why you need to take this life-threatening procedure. But anyway, like you said, we can't really understand. It's a difficult
concept to really internalize. Yeah. But until you've battled with something that's very, very, very heavy on your self-esteem, you can never relate to what some of these patients go through.
Right.
And the approach is never to shame them and never to, gaslight them into thinking that, their concerns are unfounded. It's to listen.
Right.
It's to understand.
Right.
And that's why that relationship is important. Okay? Because no sane person walks into your office because they want the surgery for fun. Or they have money just to throw away, and they just want to get lipo because, it looks cool on TikTok. None of them do. Yeah.
Okay. Have you had patients that you've told them, "Guy, please just be serious with your workout and diet. We are not doing this. You're not there yet."
So listen, every single patient who comes to our office, whether you're getting lipo, tummy tuck, we always sit down and we go through what their diet and lifestyle is like.
Okay, that's good.
Because you see, for me, how do I put it? I'm hesitant to call myself a creative because people who are actually creatives will get offended. With this scientist you're calling
what you do is art. We've already established that. Art and science. So yes, you're a creative, yeah.
So you want to put out a piece of art that lasts, all right? That's something that you can be proud of.
Right.
Okay, not something that keeps coming back and you have to fix this, you have to fix this. So some of the things that ensure that whatever results that you get today, you're going to have them in the long term, are diet and exercise.
Right.
So,
Yeah.
how soon can we get you back on your feet? Are you jogging? Are you walking? Because I want you to maintain these results for the next 20, 25, 30 years. I do not want you to come back.
Okay.
Right? If you come back, then no.
So we're not escaping. Yeah. I thought I'd escape the whole gym thing and diet. Like I really want to enjoy my cake and
It's still there.
So I can't have my cake and eat it too. Okay, cool. I know there's always talk of tech and AI and so nowadays I just make a point to understand every professional that I sit with. How is tech and AI evolving or changing your industry? Are you using AI? How are you using AI?
Yeah, I mean, so there's a bunch of really sophisticated stuff out there. I haven't incorporated them into my practice because, also the barriers of entry are high, cost-wise. But, there are applications that, with a couple of photos can predict what you're going to look like after the surgery or can analyze your nose and face, show where the problem areas are and show what the result of surgery will look like. So you're kind of simulating surgery right there in the consultation room, so a patient can get a good idea of what they're going to get next. I use AI, for myself, mainly for just administrative things. So that's like putting together treatment plans, reports, kind of things. That's where I mostly applied.
All right.
Because there's a lot of writing and reporting and that goes into treating patients.
Absolutely.
Yeah.
Before I forget, one other very that as I was doing research for this conversation, so I was looking at the most commonly asked questions.
Yeah.
To plastic surgeons, so I have to ask this: weight loss pills. I know we've talked about liposuction, tummy tucks, weight loss pills. Do those things work? One, and if they work, what are they doing to your body? And should we use them or avoid them?
Okay. Weight loss is a very, very murky waters. You need to be very careful what you're getting, who you're getting it from, where it's coming from.
Right.
Okay, because anybody can package anything and tell you that it's a weight loss pill. They'll tell you take this pill, but don't eat anything for 3 weeks. Of course, you're going to lose weight.
Never thought of that. Yeah.
Okay.
That's true.
Now, the big conversations and the stuff that's in the market right now are things like Ozempic. Okay.
Yes.
Ozempic is probably the main one up there. There are a couple of other ones. Mounjaro, there's Duramine, there's all sorts of things. Do they work? Yes, they work. But, saying they work is a very simple way to look at it. All right. There's a lot more nuanced things that you need to kind of take into account before you go into any of those weight loss injections or the weight loss pills. Again, why it's important to sit down with a professional, because people will sell you anything on social media. They will not tell you about it or how to use it or what you're going to see 3 months down the line and all those things. So I'll give you an example. Ozempic. Ozempic, or what's the molecule is called semaglutide, was a drug that was initially created for diabetic people.
Yes.
Right? So they put patients, it was FDA approved, and they put patients on Ozempic.
Ozempic, yeah.
But the patients would come back very happy after like 2-3 months because they've dropped a lot of weight. They've dropped a lot of weight. They're not eating as much, and their cravings are completely gone. So they began to study it and seeing as to whether they can just specifically use it for weight loss. And they did a ton of studies, very good studies that actually showed pretty good effects on these kind of medications like Ozempic, where you're looking at within a span of 3 months, you're losing somewhere about 10 to 13% of your weight. Right, which is a significant drop.
Oh yeah, absolutely.
Okay? But the thing with all these studies that were done looking at Ozempic is that they always emphasized that the best outcomes and the best long-term results were in patients who combined the medication with diet and exercise.
Yeah.
So they never removed those two things. Okay, because the problem comes in when you do stop, for example, the Ozempic, because Ozempic is very expensive.
Yeah.
Okay, you cannot take it in perpetuity unless you're a millionaire. All right.
Right.
So at some point, it's very likely that you're going to stop. Okay, so say you've dropped 10, 12 kilos, and now you're happy.
Yeah.
and you're good. The moment you stop the Ozempic, it's very easy for you to rebound. In fact, one of the studies showed that you regain 2/3 of the weight that you actually lost. All right.
Yeah.
If you're not dieting and exercising, right? If you're dieting and exercising, it's possible to retain the results a lot longer. And remember that at the end of the day, our eating habits are all controlled up here. Okay. So if there's no concurrent behavior change with the Ozempic and the diet and the exercise, then you can still find yourself going back into very bad eating habits and those kind of things, which will again cause your weight to balloon.
Right.
A lot of the side effects tend to be things like nausea, diarrhea, vomiting, constipation, the usual things. I don't think we have enough data or have gone long enough into this Ozempic journey to know what things are going to look like 10, 20 years from now. And it's important for the patients to understand that.
Okay.
Yeah, but so far it's actually approved
Right.
in many parts of the world for weight loss. And Ozempic is just one example.
Right.
Yeah.
How does your typical day look like? What time do you? I mean, how does your day look? Yeah, because you look like you have a crazy schedule. So just trying to figure out how do you plan your day. Do you have time for yourself? Do you have time for fun? Do you have time for family? Yeah.
Yeah. Okay. Yeah. It's a crazy balance because I'm at that age where I have to. Well, not I have to.
Yeah.
I want to do a lot because we're not getting any younger.
That's true.
And there's a certain time period. So my typical day would look like wake up at 5:30, 5:30 in the morning. I walk my dog for about half an hour, 45 minutes. Come back, shower, change. I have a small boy, usually wakes up around 7 a.m. So I'll go say good morning to him and, we chat.
Yeah.
We chat with all of his 2 words that he can speak. That we chat. Depending on what's happening during the day, probably leave the house around 7:30, maybe 8. Sometimes I leave earlier. If I have surgery booked very early in the morning, I may leave the house as early as 4:30 a.m., 4 a.m. And then pretty much the rest of the day, I'm either in clinic, in surgery, or doing ward rounds.
Okay.
Probably until about 7, 8 p.m. Sometimes it goes longer. It's very erratic.
Yeah.
It just depends on what kind of season I'm in. But ideally, I get home around 7, 8 p.m. Exercise a bit, or go to the gym if I can, if I have the time to. Again.
Gym, because I mean, I look at you and you look like you take care of your body, so you gym a lot. Have you had any procedure done on yourself?
Cosmetic procedure.
Yeah.
I've had Botox done.
Okay.
Yeah, which was non-invasive.
Right.
Yeah, I had Botox done. That was last year. Yeah, I haven't gone back again for more more injections. I just haven't had the time.
Yeah. Where on your
my face?
Oh, okay.
Yeah, I did Botox on my face last year, and I was looking 10, 15 years younger. Yeah, I feel like I need to do a bit of work on my hair.
Right.
I was told it's
I mean, because you're the first billboard of your work. Okay.
Yeah, it's important to understand the customer experience.
Yeah,
the customer journey.
Okay. I know you're a doctor, so that means you get to read a lot. 3 top books that you would recommend. This is an assumption that you read books that are not related to the medical field.
I do.
Okay, awesome.
So
it could be the top book, or if you have 3 recommendations. Yeah, my people, they always want to know what books you're reading to improve their lives. Yeah,
you've probably had these ones before. Right now, I'm reading The Richest Man in Babylon. It's a fantastic book. I'm really thoroughly enjoying it, and just how they break down finances and all those things. Because you'd be surprised, doctors are not taught how to manage their money.
We assume doctors know everything.
No,
you guys are like small gods.
Terrible with money.
Wow. Okay.
The Richest Man in Babylon. Again, The Psychology of Money. Those are the 2 books that I've read this year that have really kind of piqued my interest, and just understanding how people go about managing their finances. I want to read Atomic Habits next. I have not read it.
Okay. Those are good books. Those are very good books. I think you and I are like sharing our libraries. Those have been the books in my library this year. That's amazing.
Yeah.
2 final questions. One, do you have a stranger than fiction story? Something that has happened in your life And you're like, if I tell people this, watafikiria ni stories za jaba, but it's true. It's true. Yeah.
Stranger than fiction story. There was something that happened in my house.
Hey.
This must have been 2020, time for COVID. A lot of things that were going on in COVID.
Yeah.
And I remember I was in the house with my then fiance, and we had a few friends around, and we're having a good time. It was COVID time. Everybody's locked down, so we're having making merry. And I had put my laptop bag on the seat.
Okay.
It had been there for a while, like 3 hours, just very calmly sitting on the seat. And as the night goes on, all of a sudden, the strap for the laptop bag, it flips over and just moves. There was no wind, there was no nothing.
Hey, bro.
It just flipped over.
We are Africans.
Ni kama mtu alikuwa ameibeba, akafanya hivi.
Hey, we are Africans. You know where we are going with that. Yeah.
So I looked at everybody in the house. I think we were 3 or 4 of us. And we were like, what just happened? And we never spoke about it again. Ever. To this day.
Hey, nani.
But it still bothers me because me, I'm again for what I need the science behind what just happened there because it just absolutely makes no sense.
Hey, bro, and you were making merry, so whatever was in the room was legal.
It was legal and it was not enough for,
it was not
for people
to
hallucinate. Because everyone saw it.
Hey,
so
bro,
we packed it. We'll discuss it sometime later on in the future.
Okay.
Yeah, we are not alone. Viewers, we are not alone.
Yeah. Yeah, that is a stranger than fiction. And for you being a science man, I know that must be cracking. Okay. What's your mantra? What's that mantra that you keep repeating to yourself that keeps you going?
I have several that I go by.
Okay.
Some of them may not be completely healthy. I've always held the belief that don't complain too much. Get on with it.
Right.
Kind of things that we're taught as men. Just put your head down, get on with it. Work hard and be consistent.
Right.
Those things for me have always aged well. Yeah. Don't complain, work hard, be consistent. The reward is coming. Just wait for it. It's coming.
I love it. Don't complain, work hard, be consistent. The reward is coming. I think that's a very beautiful place to end this conversation. Thank you. I thoroughly enjoyed this convo. I know the topic we've just discussed is a very touchy one. And I'm sure there are going to be a lot of people requesting for you to come back again. And maybe hopefully on a bigger panel with an audience so that they can ask questions.
Yeah.
I hope if I reach out, you'll gladly come back.
For sure.
Amazing.
In a heartbeat.
Amazing. So if you guys really, really want to have Dr. Ogalo back here again or on a live panel, just comment, kuja kwa comments, kwa DM, let's have the conversation. Like I said, we also listen to what suggestions that you guys give us, and we want to have the healthiest conversations here, conversations that are helpful. We're still filming at Longonot Place. Come check them out for your staycation. Wambia wakupate discounts za field director. Again, thank you so much. This has been amazing. Ladies, did I ask all your questions? Oh my God. Mumekata, BBL. The class was over. Then the ladies reminded me, kuna mambo inaitwa BBL. Daktari.
Yeah.
Bana, gentlemen out here are investing a lot. You've seen this really fine babe, very curvy. Yeah, and then you get home and everything is not natural. This BBL thing. Sasa, tunasaidiana aje bana.
Yeah.
Yes. Is it a requested procedure? Is it requested a lot? Have you come across it a lot?
Yeah, it is. The requests for BBLs are quite a lot.
Yeah.
Honestly, I don't know why, but I tend to get the patients who come into my office are not necessarily going for the BBL. However, that said, I do BBLs.
Right.
The thing is, again, it's also how it has been advertised and marketed and put out there. Because when you think BBL, you think, an extremely large bum.
Yeah.
Which is not ideally the case. Okay? Because I'll explain it like this. So to do a BBL, you're taking fat from one place, okay, usually around the abdomen area or the sides or the back, and we're transferring it into your buttocks to make them bigger.
Yeah.
The idea, or at least my philosophy of it, is to give something that looks natural and curvy.
Right.
Okay, so a lot of people walking around with BBLs, you can't even tell that they had a BBL.
All right.
It's supposed to look natural and curvy. Yeah. The other reason why it's not supposed to be look gigantic is because you're not supposed to put in too much fat. Okay. So because when you put in too much fat, a lot of it dies.
Right.
Okay. So immediately after BBL, if you go to the wrong places,
right,
all right, they'll put 2 liters on this butt and they'll put another 2 liters on this butt, and immediately after the surgery, it'll look very dramatic.
Yeah.
A week, 2 weeks will pass, but by the time you're 3 months down, a lot of the fat has died, and you're left with pretty much not too much. So it's supposed to be a subtle increase in the buttock, ideally.
Yeah.
All right, ideally. An increase, yes.
Yeah.
But you don't put in too much. You don't pack it in there like it's like a samosa.
I'm sorry, my mind has just gone poof.
Yeah.
So how soon after BBL am I allowed to sit down again? I'm just I just went there. Wait, that's a procedure on your bum. So tunafaa kuketi after how long?
No, the aftercare is quite serious.
Yeah.
You lie on your tummy. Even your sides, not so much. You get this actual called a BBL pillow. If you really need to sit, you go on that. And there's BBL mattresses. There are a lot of accessories that come with it. It's like buying a car. It comes with tires and all these other things that you need to put together.
How long does that
sitting on it? You're looking at 4 to 6 weeks.
Hey, wikisita hujaiketi. Wow. Okay. Yeah, I'm still trying to. Okay, so how do you move on? So even when you're sleeping at night, you can't lie on your back. Hey, wait, tunafaa kuishi aje?
Ideally not. So technically you can. It's just that it can affect how much of the fat survives.
Yeah,
so
of
if you
course.
don't want to do it.
Si wasichana tu tujipende haki. Okay, let's end it there. Thank you so much.